You're welcome to today's show. This is Bonds here on AGTV. This is the Assemblies of God Ghana television. And Bonds is the family life show right here, talking about everything and anything to do with you and your family. Cervical cancer is one of the most preventable cancers, yet it still impacts many families each year. Today on Bonds, we will explore this topic, which is essential for every family's health. Cervical cancer, the importance of regular screenings. We will also talk about how families can support a loved one through diagnosis and treatment while encouraging open, healthy conversations around reproductive health. Let's learn how to protect and empower our loved ones by staying informed about cervical cancer. Now, we'll come back after this short one, but before we go, let's take our scripture for the day. It says, "Beloved, I pray that all may go well with you, and that you may be in good health as it goes well with your soul." This scripture is from 3 John chapter 1, verse 2. Don't go anywhere.
Hey there! You're watching Bonds, the family life show. Woo! A family that sticks together will always be stronger through the stormy weather. I have you, and you have me, and that's what makes us family. It's the family life show. 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 You're watching Bonds, the family life show.
You're welcome back from that short one. My name is Mawutor Seade, and this is Bonds, the family life show here on AGTV. If you're watching us on YouTube or on Facebook, you can leave your comments, your questions, and share your personal experiences as well. Before we went on that one, I mentioned that we'll be talking about cervical cancer. How important is it to know about it? What should we really know? What should we pray about? And what should we run to the doctor for? That is why we are here to have the conversation today. You can follow us on @myagtv on all of our social media platforms. Don't go anywhere and call somebody to join in the conversation. To help me have this conversation today, I have two experts in the house. First is a popular face. She is in the person of Louisa Graham. She loves to be called Nurse Louisa. Nurse Louisa, you are welcome to us today.
Thank you.
Now, Nurse Louisa is a highly experienced registered nurse with 15 years of dedicated service, specializing in providing top quality, compassionate care. She is very highly educated in the field of public health and allied sciences. She possesses extensive expertise in maternal and child health, reproductive health, effective triaging, counseling, and helping patients achieve their health goals. She's an active member of Dorcas Medical Missions and the Christian Broadcast Network's Medical Missions. Currently, she works with the Ayawaso West Municipal Health Directorate as a public health consultant for Kulan Consult. Once again, Nurse Louisa Graham, you're welcome.
Thank you.
To help her have the conversation is Dr. Jean Benson. Dr. Jean Benson is a registered diagnostic medical sonographer, registered with the Allied Health Professionals Council of Ghana. Currently, he works with the Shai Osudoku District Hospital and is a team faculty member of the MedPrime Academy, which is an online educational institution that offers healthcare courses. Dr. Jean Benson, you are also welcome to the studio.
Thank you.
It's a pleasure to have you both. And we are talking about another health matter. I mean, this whole period, we've been talking about one health matter after the other. Either we are talking about children with disability, we are talking about, breast cancer, prostate cancer. Today we are talking about cervical cancer. So first off, let's get it clear. What is cervical cancer? Dr. Benson.
Cancers are diseases that occurs when cells which are abnormal, they divide abnormally and then affect the tissues of a particular body. Okay. So then when these cells occurs at the cervical region, then we say that you might be having what? Cervical
cancer. Okay, okay. So is the abnormal cells, how do they even come about? Do they just go crazy on their own? Nurse Graham.
So just like what he said, so the human papilloma virus on the cervix, so the cancer virus is on the cervix. So the cervix is basically the tip of the uterus or the womb. So the womb is like a bag with the tip of the bag. So the tip, which is the cervix, which is inserted or it's positioned into the birth canal or the vagina. So you get the virus or the cancer cells on the tip or the cervix. So basically, that is cervical cancer.
So our cells can decide to just go crazy on their own, especially because of some things we may or may not have done. So let me ask the question that a lot of people might have. Can I be born with cervical cancer?
No.
You cannot just be born with it.
No, you don't just... No.
No one is born with cervical cancer or cancer of any sort. But it's the exposure. So the person, let's say the female, is exposed. It could be through oral sex or penile sex. So when the male has it on the penis, the woman then picks it and then it harbors on the cervix. So if that female hasn't gotten the vaccine, she's then prone or eligible to get it when picked during sexual intercourse. And most often when the person has multiple sexual partners.
So that veers a bit more into the causes of cervical cancer. But before we get there, let's talk about how important is information about cervical cancer to the family.
Cervical cancer is highly preventable.
Okay.
And then early detection always is the key.
Right.
If we can detect it very early, then you are on the road to preventing it. But then you see, most of us, or most, excuse me, say, let me use the blacks, we hardly would want to just go and have a screening for these particular diseases, disease conditions. And we always want to stay in the house till the whole thing has become another story. Then we quickly run to the doctor and then seek for medical help. And unfortunately, when you get there and it happens that you've entered into the terminal stage, when I say terminal stage, it means that a stage where maybe little or much can be done to save your life. That is when we go to the hospitals. But if the family could have knowledge about cervical cancer, its causes, and then maybe the things we can do on our own
to prevent
them, then also maybe the early signs and symptoms of cervical cancer, then I think that it will go a long way to actually address the problem.
So you've just gone into what I was going to ask, which are the early signs and symptoms. What are they? You know, doc says that we wait until we see something. It's a popular thing. When you say I'm going for checkup, somebody will ask you, next question is, what's wrong with you? Because it's quite unusual that there's nothing wrong and you're just going to the hospital. But I think gradually we are learning that it's advisable to do the checkups. But assuming it's not a regular checkup, what signs, early signs, can I see and say that I need to have this checked? Nurse.
So I would say as a female, so we all menstruate. So you are getting bleeding in between your menses. So let's say today is the 5th of November. So first you've menstruated to the 5th. You've ceased menstruation. But then on the 15th, you are menstruating again.
Which is just 10 days after.
Vaginal bleeding.
Okay.
You get it. So it's a sign. Then painful sexual intercourse is a sign. Then you're also getting blood in urine. As you urinate, you see blood. It also calls for prompt attention. And then foul smell. So excessive vaginal secretion, that comes with a stench or an odor, very offensive one.
Which is quite similar to what happens when you have the normal vaginal infection, isn't it?
This is an extreme case.
Okay.
It continues, it doesn't cease. You get most people coming in, they will tell you, oh, I thought I had that and I had this, so I've been taking over-the-counter medications for this particular time, and I'm not seeing any improvement.
Right.
All these things brings a lot of questions on board.
Okay. Doc, you want to add some?
And most of the times, women who are sexually active, they sometimes,
you are pardoned. You are pardoned.
Get it in their lifetime without even knowing, because it doesn't really show any symptoms from the beginning. And our immune system is programmed in a way that it's able to clear away certain things even before they turn into
something else.
Yes. So sometimes it might not show at the early stage. That is why you need to come for us to check.
Because you may not see
you
anything.
Might not see anything. But then gradually things are happening in the background. And by the time you realize, it might have crossed the line for you. Then she spoke about bleeding intermittently and all that. Normally, this cervical cancer, young women are prone to it. But then for postmenopausal women, it happens that you are not supposed to be bleeding, as in having your menses, because you are in your menopausal phase.
Right.
But then if you start seeing blood, you need to come to the hospital. You
because
need to
it's
be
not
checked
usual.
because it is not usual.
Right.
And it could be one of the signs of cervical cancer. When you are just there and then you are having a weight loss, unexplainable weight loss, it could also be a sign of cervical cancer.
Especially when you're not checking your figure.
Yes.
And it's just happening on its own.
Any dieting, nothing, but you're just losing weight.
You are just losing weight. You need to get checked.
Is it a kind of cancer that affects men as well, or they can have it but they only transmit it?
Men don't have
you
cervix.
need to have a cervix. Okay, right.
But then we can still transmit it to you. So because I do not have a cervix, it will not go over there. I wouldn't have issues over there. But then when it gets into the woman, then it can easily proliferate, then things happen over there.
Okay. So if I understand correctly what you're suggesting, the HPV, which is the human papilloma, did I get that right?
Yes.
Papilloma virus, is that the cancer-causing virus, which means it can cause any other cancer, or it's peculiar to cervical cancer?
So I would say with the males, the male will be carrying it. It can migrate to the rectum to cause anal or rectal cancer. Okay. But when the male has sexual intercourse with the female, the viruses then moves to the cervix. That's when she would then exhibit the signs of the cervical cancer. So when it's here, it's different. When it's here, it's different. Okay. So it depends on where it finds itself, and the name will give it to it.
All right, so we'll be back after the break to continue the conversation. If you've just joined us, you're watching Bonds, don't go anywhere. We'll be back shortly.
It's the Family Life Show. You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you easy.
Vision without action is an omission.
Raise your head high, for AGTV is here.
It's the Family Life Show. This is Bonds, the Family Life Show.
Welcome back from that break. This is Bonds on AGTV. My name is Mawutor Seade. I'm here with Nurse Graham and Dr. Benson. And we are talking about cervical cancer. So far, we've gained a lot of information, especially on what it is and how it can be contracted. But let's go to who is most at risk when it comes to cervical cancer.
Younger women.
Okay.
Younger women are at risk of cervical cancer. Then also women who have persistent infections with the HPV virus. Okay. You are also at a higher risk of actually getting infected. Then also HIV. HIV. Yes. If you have tested positive to HIV, then you should be very careful, because at any point in time, you may get cervical cancer. Globally, cervical cancer is the fourth most common cancer in women, with around 660,000 new cases as at 2022.
Wow. Which means by now, that number
might have either doubled or tripled. You understand? And in the same year, about 94% of the 350,000 deaths that occurred were by cervical cancer.
Wow.
So, you see, we are not making noise about it.
Enough.
We are not talking about it enough. But it's a silent killer. And a lot of people are losing their lives because of cervical cancer.
You have something to say?
In Ghana, 100,000 people, you are getting about 29% dying from cervical cancer.
Dying?
In Ghana. So, just like you said, the immunocompromised clients, the HIV clients, they have a higher risk. Our Hep B clients, they have a higher risk. And then multiple sexual partners, women with multiple sexual partners. And then early exposure to sex, vaginal sex, oral or penile sex. You call it have
indeed, Dr. Benson mentioned it. We don't make enough noise about it. I'm tempted to blame you know, the health sector, because we hear a lot. We used to hear a lot about HIV. We hear a lot about breast cancer. We now hear a lot about prostate cancer, but cervical cancer, we are kind of quiet on it. So a lot of us think it's not that bad or it's not that common. But hearing it from you, I think all of us should wake up and do our bit. But having spoken about that, let's talk a little about, you know, you've mentioned some of the things that may expose a woman to getting cervical cancer, you know, and early sex is one of the ones you just mentioned. Is it to say that very young girls, as early as 12 or 10, should they be exposed to sex, are likely to get cervical cancer?
Actually, they will. But the fortunate thing is, by the age of 9, 12, you can get the vaccine. Yeah. Okay. You can get the vaccine. And when it comes to sexual orientation and sexual health, it's about you, the parents, telling them the good, the bad, the evil, and all that comes with it. But the choices depends on the child. But if the child is able to tell, if I'm able to stay out from sex, these are the exposures, these are the good things, these are the bad things, I think health is a personal thing. Yeah. The family will be there to support you, but the pain is personal. You get it. So it comes to education from the family settings and we, the health workers, too, outside.
Dr. Benson, tell us a little bit about the vaccine. You've mentioned it, she's also mentioned it.
You know, as of 2013, there are about 6 HPV vaccines available globally. Not as in 6 bottles, but 6 different types of HPV vaccines.
You're talking about something similar to the COVID where we had the Astra something. Yeah. Okay.
So all these vaccines protect against high risk HPV types like the 16 and then the 18, which cause most cervical cancers and have been shown to be effective in preventing HPV infection and then cervical cancer. So if you could get yourself tested and it happens that you are negative, you can take the vaccine. Okay. You can take the vaccine, which will go a long way to help prevent you from getting infected.
So you mentioned as young as 9. Is that the legal age for receiving?
As young as 9 to, let's say, 12, 14,
you can get it.
You should get the vaccine.
Once taken, safe for life?
Oh, not really. Not really. It's mostly like between 5 to 10 years.
Then you have to take it again.
You should go back for a checkup again, and then if it happens that you are still negative, kudos to you. You still have to take a shot again.
Wow. No, seriously. Next, Graham, this question is for you. Let's talk about the 9, 10, 11, 12-old girl. Can we give the vaccine to boys as well, since they are the ones who carry it around? If they are vaccinated and they don't get it at all, then they don't give it to anyone at all. So I'm just asking, since girls can take it, can boys also take it?
For vaccination, we do for boys and girls.
Okay.
And then we do the education for both.
Okay.
But for that early age, we do that so that at least averagely the girl is not sexually oriented or exposed, so that she gets the protection at that early age. That's why we do it for the both of them. But we equally do counseling. That's why after everything we tell you about HIV. HIV is real. So you counsel, you do the injections, and then we do follow-ups. So the child then comes back, do the routine checks, in anything, continue with the vaccinations.
Right.
That's what we do.
You know why I'm finding this quite fascinating? Because this is one of the few times we're talking about cancer and we've gone all the way to the young children, and sex is in the midst of it all, which means everything in life, diet, health, sex, education, we all as a family, both the young and the old, must be actively involved to keep the family safe, both boys and girls. We've talked about HPV at a point, and you mentioned what it was, but just for the sake of clarity, Dr. Benson, can you go a little bit more into what HPV really is and what are the other damages it can cause when one contracts it?
All right, so the HPV we have been mentioning all over the discussion is an acronym for human papilloma virus.
Right.
All right, so then it is a common sexually transmitted infection. Okay, which can affect the skin, the genital area, and the throat.
Oh.
Yes.
Now you've gone foul.
That's why I spoke about oral sex.
You mentioned that it's true.
She mentioned oral sex, so it can actually affect the throat, the skin, and the genital area.
Oh my God.
So almost all sexual active people will be infected at some point in their life.
Oh.
Yes, so initially, you see that I made a reference to a point where I said that sometimes people even get, without even knowing. Because it wouldn't show any sign or symptom. You understand? So that is the virus we are dealing with.
The skin, the throat, or the genital areas. Assuming it affects the skin or the throat, how will it show? I mean, how do you know that you've been infected?
There will be persistent skin disorder. So some of these disorders, you get normal disorder, you apply or you seek for a medical counsel, they'll give you the topical application. But this one, it wouldn't resolve by itself. You get it. So you have to pick the biopsy, you do biopsy, so a sample of the skin to check what is the cause. So with cancers, we have to pick a part of the skin. That's what we do the biopsy to know which type of cancer, because we equally have skin cancer.
Okay.
So we get to know whether it's the human papilloma, then we treat it as well.
Thank you so much. We'll be back. Don't go anywhere. Don't go anywhere. I know it gets heavier and heavier, especially when we're talking about health and matters that concern our lives. But don't go anywhere. You want to stick and stay. We'll be back shortly.
It's the Family Life Show. You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you easy.
Vision without action is an omission.
Raise your head high, for AGTV is here.
It's the Family Life Show. This is Bonds, the Family Life Show.
You're welcome back from that break. If you've just joined us, this is Bonds here on AGTV. We are talking about cervical cancer. And before that break, we talked about the virus that causes cervical cancer, which is HPV, human papilloma virus. I just love the rhyme of the word, even though it's quite dangerous, considering the fact that it can cause problems on the skin, in the throat, and at the cervix, which then translates into cervical cancer. We've talked a bit about we need to know. How do we get to know that we have cervical cancer? Let me start with you.
Walk in and do your checks. So our routine checks.
When you say walk in, where?
To the OPD, any public
hospital
or private hospital.
Okay.
You can walk in and do your checks. You do, just like we do our dental and our ear and eye checks, we encourage our thorough body checks.
Okay.
So as you haven't received the HPV vaccine, you come in, you do your check. If you are non-reactive, you take the vaccine. If you are reactive, we continue with the biopsy or all other investigations, and then we know how to intervene.
Let's just say you are the nurse here. So let's just say I'm an ordinary person. I walk into the hospital. What language do I use to communicate? I'm coming to check to see. Is it to check to see if I have cervical cancer? Or what would I say?
So you walk in with your card as usual. Then you tell them you want to see the general practitioner.
Okay.
So you want to see the doctor. So when you get to the doctor's office...
Please, before you continue, a typical hospital, you can't just walk and say, I want to see the general practitioner.
They will check your right for.
What is wrong with you?
The thing is...
Let me cut in. You know, when you enter...
Please help us.
When you enter into a hospital, there are general things we do.
Yeah.
Okay, so you go for your card. Some people, we are not even doing cards anymore. We are going paperless.
Digital.
So you just send them the card, and then they are able to process you.
Okay.
You go check your vitals. Now, everybody that walks into the facility will surely see a doctor. You don't just walk straight, see a nurse, and then you go to do labs. No.
Okay.
So definitely you will see a general practitioner. Anyhow. So when you enter there, one, there are two things involved. Either you already have an idea about cervical cancer, and you just want to do it straight.
Okay.
Or maybe you are there to tell them your symptoms. So in the course of telling the doctor, oh, what's happening to you, I'm losing weight, I'm becoming like this, I'm having foul discharges, and I'm bleeding in between menses and all that. So from those particular information you are giving to the doctor, then he might say, okay, then you will need to do this.
This test.
So it's easy to actually do. Just go to the hospital, and then it's actually free.
I love that part.
We don't charge for the screening of cervical cancer. In fact, it will be our joy if the whole community, if the whole country, maybe we decide that this particular month we are putting it down for free screenings. It will be good. It will be nice. And that is what we are actually looking forward for.
Okay.
Just like we do for breast cancer.
We should be able to do the same for cervical cancer and maybe even the prostate cancer as well. That's a good one. So it's free. Walk into any hospital at all and just ask to see any health practitioner or general practitioner, and then you can request for it to be done, and it's free. I'm stressing the it's free part. And I think, you know, Nurse Graham, you mentioned something the last time we were together, that we should trust the system. I think it's trust that has been lost that we all need to get back. And so all of us, everybody viewing us today, trust the system, have confidence, go. And it's your right. And trust me, with their word, you can say that you watched on AGTV on Bonds. The doctor and the nurse says that when you come, it is free. It is supposed to be free. And hopefully you will get it done. But let's go a bit into pap smear. It's a word that we hear thrown around a lot when we are talking about cervical cancer. So very quickly, Dr. Benson, what is pap smear and how often should one get it?
All right, so with pap smear, it's actually a laboratory test that is performed on you. But then this time we don't take your blood sample.
Okay.
Okay, so there is a particular device that is given to you, or maybe the doctor or the nurse who is in charge will have to apply on you. Now, what happens is that it is inserted through your vagina, then close to your cervix. Then samples are picked from there, taken to the laboratory. Then it is tested to see if you will react to our almighty virus.
I love the almighty part. So is this also something that you can voluntarily go and have done, or this needs to be prescribed by a medical doctor? Just like you
walked in to see the general practitioner, and there is a need, in case you have signs and symptoms, there's a need to, or a voluntary, like the routine checks. So it's a continuation of all that process to confirm whether you are reactive or not. So that's
is this also free, or this one you must pay?
It depends on the hospital protocol.
Okay.
Yes, it depends. But at a token, not an exorbitant price. Yeah.
All right. At what age should women start getting screened? Let's say, especially for the pap smear, because we said that the vaccine can be at a younger age, but at what age should women get the pap smear done? Dr. Benson.
So at the age of 35.
Okay.
At the age of 35, you should be able to get it done. Then at the age of 45, you should do a second test.
Okay, so that's 10 years apart.
Yes.
Is it on the assumption that after the first one you would take the vaccine, or?
Sure.
Okay.
Sure.
What if you don't get vaccinated after the 35th year's screening?
So you did your screening at the age of 35. Now, there are two outcomes. It's either you are positive or negative.
You are negative.
And we are assuming that you are negative. So you cannot walk out of the facility
without
taking the vaccine. We are expecting that you
That's
should
the advisable thing to do.
So if you should take the vaccine, then we are expecting that at least it should be able to last you
about
that
10
time.
years.
Then you need to come back. We do the checks again. And if it happens that you've been able to do the due diligence, not to get it again, you have to
do it again and then check again. You have to confirm you are not reactive.
Okay. All right, so as and when you can walk in and have a pap smear done, but the advisable thing, you know, if we take your word for it, is immediately you realize you're negative, take the vaccine. Go have yourself checked, do the pap smear, and take the vaccine if you find out that you're negative, which we pray that you are. But don't go anywhere. Bonds is still here. We'll be back shortly.
It's the Family Life Show. You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you easy.
Vision without action is an omission.
Raise your head high, for AGTV is here.
It's the Family Life Show. This is Bonds, the Family Life Show.
You're welcome back from that break. Remember to follow us on @MindAGTV on all of our social media platforms, and also share the link so that other people can get involved in the conversation, especially if you are watching on YouTube or on Facebook or on Instagram. Like our pages as well. You're still watching Bonds. Today we are talking about cervical cancer, and I have with me Dr. Benson and Nurse Graham. We've been having the conversation so far. If you've just joined us, we've talked a bit about what it is and what are some of the causes and what screening opportunities are available. The key thing to take away from this is that it's free to get screened. So please walk to any hospital, ask to be screened, and you can be checked for free. Now, back to screening a bit before we continue to our next point. Dr. Benson, you were mentioning something about those who are eligible for screening and what the modalities are.
So like I was saying, global strategy encourages a minimum of 2 lifetime screening.
Okay.
With high performance HPV test by age of 35 and then 45, like I said. But then when it comes to our side, because it's mostly to this, the younger generation, so at age 30, you should go in for the screening. Okay. Because you don't know what could happen. Now, you can't wait for 35 before you want to screen yourself. Then also, women who are HIV positive, all right, so they have to get tested almost every 3 years. Yes, almost every 3 years, starting from the age of 25 years. You should be able to check and check. But
that, can they not take the shots? If after the first check it is negative, can they not take the vaccine, nurse?
So for them, their immune system is compromised. So when you introduce the vaccine, they might exhibit signs and symptoms. Oh. So what vaccines basically are is a weaker version of the causative organism. Right. So it's introduced so that your body will build immunity or resistance. Right. So with this particular person, the immune system is somehow low. Right. Already weak. And then you are adding on.
It may rather break them down completely. It will trigger
the effect. Wow. So for those people, we encourage the routine checks and then.
So they can only go for the screening, regular screening, but they cannot take the shots, the vaccine. No. Wow, that's quite interesting. Next, Graham, let me continue with you. What's other preventive measures or lifestyle choices can be employed to minimize the risk of contracting cervical cancer?
So take the vaccine.
That's the guaranteed way.
That's the guaranteed way. We do our routine checks. And then when it's detected early, we try and then go on with the treatment sections. So if it's way on board, we do the hysterectomy. So we remove the uterus with the cervix away so that the person can live a healthy, normal life. So
wow, you've gone past. You've just zoomed off and left her somewhere there. So wow, that's a very extreme way of helping someone who's already contracted cervical cancer.
If it hasn't moved other organs in the body or the pelvic area, let me put it that way, this can be done to help the person live a healthy life.
Let's add on to what she's mentioned, but I want us to focus more on lifestyle choices that can help prevent it before somebody may contract it to start with.
All right, so we spoke about multiple partners.
So avoid multiple sexual partners.
Yes. Then also condom use. If you can't, then condom use. Okay. All right. Then avoid smoking.
Okay.
Now, even with the smoking, we have the first-hand smokers and then the second-hand
smoking.
Yes. So that I might not be seen with the cigarette smoking, but I sit around people who smoke. Right. I am at a high risk.
Probably even higher.
Higher risk, yes. Because I smoke it directly into my lungs. So then those ones, now eating well. foods high in antioxidants, they are very good for us. Then other cancer-fighting nutrients. Then avoid diets high in saturated and trans fats, sugars, and sodium. We should be able to avoid all that. Then exercise. We don't exercise.
We don't exercise.
30 minutes of exercise in a week will not kill us. Some people are so busy that they feel like maybe when we come to work, because you walk from here to here, it's a form of exercise. But now we want you to be intentional about it. I want to exercise.
Okay.
But then let's be intentional about it. Let's do more of the exercising.
More of the exercising would help. Yeah. He mentioned foods rich in antioxidants. Let's pretend we don't know what that is and help us out.
Let's do more of our seeds. So our wheats, our oats, our grains, our fruits and our veggies.
Okay.
Our fruits and our veggies, yes.
Fruits
Something
and
like
vegetables.
Oats, you wouldn't overcook your oats. You take it like your medicine. It's very good, yeah.
Our normal oats.
Just the normal oats. Just add your water and that's it.
You shouldn't put it on fire.
To boil, you are spoiling it. So it would reduce your cholesterol, reduce your sugar level, which is very good.
Wow.
You can add banana to sweeten it instead of adding
the
dairy or sugar. Yes, to sweeten it. You can do the same with your oats, your wheats, your rice and all that. You do more nuts. So the almonds and all that.
The granules.
Yes, you can do all
cashew nuts. Okay. Okay. You know why I'm nodding, right? Yeah, I think I've managed a few of those, except the cooking of the oats. That one I thought it was okay, because oats look so raw.
Oh, it's hard from the beginning, but you get to appreciate it with time.
That should be okay.
Less processed foods, which we don't get the fats.
I love that. We would actually live longer. But let's come a bit to the family, yes? What are the dynamics when it comes to the family? What role can the family play, especially when it comes to early detection, diagnosis, treatment, and aftercare? Dr. Benson, starts for us. What role can the family play?
All right, so the family is the first point of call when it comes to diseases, infections, and all that. Now, before the person even gets to a doctor, you will surely have talked to a family member.
Right.
And you might even need money to get to the hospital. So the family plays a major role when it comes to diseases and all that. And then cervical cancer is not an exception.
Right.
Now, when we are in the family, we should be able to be very vigilant.
Okay.
There are people who are in the family and don't even see each other in a long time. I mean, immediate family. I'm talking about immediate family.
Father, mother, children.
We don't see each other. So we don't even know what is happening
to the other person. Right.
I myself, I'm also a corporate. One way or the other.
May you be delivered.
I will Jesus name. Have ushers here.
Protocol members to hold you when you are falling.
You see, and it's very bad. Now, communication is also key. I woke up this morning, I'm not feeling well. Mommy, daddy, it looks like I'm not feeling well. Sister, it looks like my head is aching me. What can I do? I woke up and I'm having this dizziness. What is happening? So communication is key. We don't do that a lot in our setting. Maybe some people do, but at least majority of people, they are self-centered. They just think about themselves. But it is important that as a family, we should be able to look at these very petty things about ourselves so that we can prevent a major havoc from occurring. You understand?
Right.
Then also, we should ask the necessary questions. We should ask the necessary questions. Now, when our kids come back from school and they are talking to us about certain things, let's not be shutting them down.
Are we listening?
Once upon a time, years ago, when my mom speaks in the local dialect and then we speak in English, do you know what she says? I bought the English for you, and now you are, trying to, yes, I understand her. She might not be so fluent in the English. She feels like you should speak the local dialect so she will understand.
Exactly.
But you see, sometimes our kids learn a lot when they go to school. The teachers teach them a lot. Now, when they come back home, oh, mommy, we learned about cervical cancer. Then I should be interested in what my child is telling me.
Get information,
get cervical cancer my daughter is talking about?
Right.
Now, after getting the information, then we need to get, so you see, you are so much interested that you want to do it. You want to go the next step to see what it is. Okay, then let's go to the hospital this weekend, and then let's see what's happening. Right. So then the doctor will explain more.
So we get a lot of knowledge.
It is very, very important.
It is very, very important. Be vigilant, communicate effectively, and listen. I'll come back to you in a moment after our short break so that you add on to that the role that the family has to play in all of what we are discussing. Now, if you're still watching us, thank you so much for sticking and staying. This is Bones. We're talking about cervical cancer. We'll be back shortly.
It's the Family Life Show. You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you easy.
Vision without action is an omission.
Raise your head high, for AGTV is here.
It's the Family Life Show. This is Bonds, the Family Life Show.
Welcome back from that break. We are still talking about cervical cancer. And before we went on the break, we mentioned a few things that the family can do to stay connected. And the two key words were be vigilant and have proper conversations. Communication is key when it comes to early detection and helping the family through such a crisis as cervical cancer. Before we went, you were going to add up to what he said.
So just like what he said about communication, in our traditional settings, certain topics are a taboo to talk about, especially the menstrual cycle.
And sex.
And sex, yes. So you get a girl menstruating and in between bleeding and all that, and she can't explain. She can't get somebody to talk to. She would confine in a peer who might be a teenager just like her.
And may not know much.
Good.
Right.
Good. So we encourage that let's talk to each other as a family. Not just mother-girl talk, but the father could talk to you too. And then we explore into our private lives, our medical challenges. Let's share concerns. Let's show empathy. Let's be there for each other. And then another thing is, apart from the family settings, health personnel visit schools. So we go for school health hygiene and inspections. We do health educations in our JHS level, our SHS level. So when these kids come back home, let's explore what they were taught, their perception, their conception, anything. Have they ever had any experience? Let's share. Let's make the bonding continue with time. We should build upon each and every time. So that's what I wanted to say.
Right.
Thank you.
The bonding must continue. And I love what you mentioned about going to schools and talking to the children. I think it should be expanded into the church system as well, where health professionals can go to churches and create awareness about some of these things. Now let's go a bit into the treatment options that are available. So, even though we are saying it, but we all know that not everybody may have the opportunity to get tested and be negative and be vaccinated. Something may happen along the way and somebody may contract cervical cancer, in which case, what options are available to that person, Dr. Benson?
Okay, so when it comes to all cancers, most of them, their managements are looking similar.
Okay.
Now, cancer spread, if not quickly addressed.
Right.
So they can quickly spread.
Okay.
So if you wait for it to get to that stage of spreading, each treatment is different. Now, if it happens that it is just localized to a particular area, each treatment is also different.
Okay.
Now, when it happens that it's just localized, like she earlier said, you can actually go for a hysterectomy.
Okay. Explain that, please.
Now, hysterectomy has to do with the total removal of the uterus and the cervix.
Because the cervix is attached to the uterus.
To the uterus.
Yeah.
You cannot, then when you leave the cervix, then it looks like you've done nothing. So you just have to take everything out, and the patient can live a normal life. You'll be fine.
You just can't have babies.
Yes, you cannot make babies. Even with that one, we can find a way of, yes.
There are other options available, exactly.
We can help you out with those ones. Then if now there is a spread, what happens is that metastasis, so it spreads. So what happens is that you need to undergo certain procedures like chemotherapy, Chemotherapy is there for you. So you speak to your oncologist, and then they take it up from there.
Are there instances where maybe a patient comes in, it hasn't yet spread, but the patient chooses to not go through the removal of the entire uterus? Are the health professionals, obligated to go with maybe the chemo so that they can, keep the uterus but tackle the cancer? Do you have situations like that arising?
Yes. So just like he said, it depends on the level.
Okay.
So even with the hysterectomy, removing of the uterus, we can even save the ovaries.
Yeah.
Oh, okay.
We can even save the ovaries. So it's about counseling and how far it's gotten into. So if it's at a localized place, you take it out with incision. If it's spread, you take everything out, you save your ovaries for other purpose. You can do surrogacy, you can do IVF and other options. So that's also there.
That's also available. Apart from the chemo and the removal of the uterus, I'm avoiding the term again, are there any other herbal medications, prayer sessions? Talk a bit about that. You are the pastor here, even though you are a medical doctor.
So, now, when it comes to herbal medication, nobody is saying they are not good.
Okay.
But what happens is that you might not even know the dosage you are even taking. Now, the composition of the herbal concoction or medication, you don't know it. You might be curing cervical cancer, but it might be affecting another organ somewhere. So we don't really go in for that. Then when it comes to health matters, I know a man of God, he will tell you, go to hospital. Now, they are and yet pray for me. Yes. And I like those pastors who are so frank.
It's a matter of honesty.
Or you call them, they are so honest. God does a lot. He has given us the wisdom to do a lot of things. But what wisdom should do, no amount of prayer and fasting does them. Right. So it is important that you take the necessary steps to get cured so that you can also live a free life. We need you alive. You can't come and die.
Even God needs you alive.
God needs you alive. You understand? So it is important that you don't apply herbal to cancers. And also you don't do faith when it comes to what you need to do. It is true that faith heals. Right. It is true. But you see, sometimes God gives us the opportunity to apply faith that works. Your works must talk for you.
Right.
Okay, so as we are praying, we are also working it out.
We should be working. My pastor will popularly say that God will not do by miracle what you must do by responsibility and common sense. So going for the checkup is the responsibility that behoves on you as an individual. Then God will be doing his part as you pray. Let's talk a bit about misconceptions here. What are some of the common misconceptions out there when it comes to cervical cancer that the family needs to be aware of?
The most common ones is it's a curse. Somebody has cursed somebody somewhere in our family. This person is jealous of that lady, and she's growing up to be more beautiful than the others. And it's a whole lot, and witchcraft and all that. But there's one thing we have to bear in mind is that we are health workers, but first of all, we are Christians. Okay. We are Christians, so we apply all these things in our profession. For the misconceptions, it comes in a lot, but the thing is, disease-causative organisms are real.
We cannot run away from it.
Yes. That's why we invent medications. That's why we are wearing clothes. That's why we progress with time. So all these misconceptions, it doesn't hold. We have clients who are equally religious heads in various institutions, and they are adhering to their medications, and they are living long.
It doesn't stop you from being a Christian, does it?
Yes, it doesn't. Actually, it doesn't.
Anyway, and it is not everything that is caused by the devil, is it? Or somebody
must, popular saying, someone is
doing you.
Somebody is manipulating.
Is it also possible, because there are weird misconceptions out there that if you're growing and you are not giving birth, and you are not married at your age, you are not giving birth, you will get fibroid, you will get cervical cancer. Is there any basis to that at all?
So these are just misconceptions. It's not true.
There's no basis to that.
There's no basis to it.
At all.
Yeah.
Thank you very much. We'll be back to finish up. If you've just joined us, it's Bonds. We're almost through with our discussion on cervical cancer, but don't go anywhere. We'll be back shortly.
It's the Family Life Show. You're watching Bonds, the Family Life Show.
For every moment you need to be inspired.
You cannot be prayerfully alive, and Satan will get you easy.
Vision without action is an omission.
Raise your head high, for AGTV is here.
It's the Family Life Show. This is Bonds, the Family Life Show.
Welcome back from that break. We are still talking about cervical cancer here, and it has everything to do with the family. Our health is indeed our wealth. Now, before the break, we've talked about so many things, and I mentioned something just before we went on the break, that God will not do by miracle what you must do by responsibility. Yeah. You know, you mentioned something about herbal medicine, and we're in Africa, and we all know how much faith we place, especially in our herbs, and the idea of traditional medicine, which is the herbs and all the orthodox methods that we know in today's world. If herbs are not the way to go, the other vocabulary out there is alternative medicine. Yeah. Is that a possibility to consider?
So herbs in itself are not bad.
Okay.
Herbs are good. We've known them since day one of creation. Now, the issue now is about who administers the
and
herbs.
The kind of way in which the administration is done, isn't it?
Yes, that is the most important thing. Now, you don't go to hospital after being diagnosed of cancer, then you decide to go and then prepare your own concoctions at your backyard and apply. That wouldn't help you. But then if a certified personnel is a medical personnel who has studied herbs and is able to prepare for you to take, I think that one will not be a bad idea.
Okay. It may be considered.
It may be considered.
It may be considered. Though, I want us to be careful about this.
So when it comes to cancer treatment, we start like A, B, C to Z. You are in A. As treatment progresses, we have to be reviewing. Are we going forward? Are we going backwards?
So you need
with a herbal professional, how is the person analyzing and assessing the progress of treatment? So all these things come to play. Dosage. How long? For how many times?
So in what quantity?
Yes.
Right. So definitely a proper health setup is required when cancer must be treated. Now let's talk about some of the key messages we would want the family to take away. Today we've talked about health, we've talked about women especially, but we've roped in the men and we've said that it concerns the entire family. What are the key messages you would want the family to take away when it comes to cervical cancer? I'll start from you and then I'll come to you. And these will be your concluding remarks.
Let's do early screening. Let's take our HPV vaccines. Let's eat right and make our food our medicine. We should exercise, eat a well-mixed diet. And then that's it. And then comply to all that will be told. We'll be okay with that.
We'll be okay. We'll be okay. I love it when you say that. It's a very hopeful and, you know, filled with faith. We'll be okay.
We'll be okay with that.
We'll be okay. Dr. Benson.
Families should actually be prepared for anything. Because in life, we give room for eventualities. And as such, let's talk about everything. Let's be vigilant. Let's be communicating. And also be interested in each other's problems. Now, when somebody in the family gets diagnosed of cervical cancer, it is not a death sentence.
Is it contagious? I forgot to mention that.
No.
So it is not contagious just because she has, I'm sitting by her. Then
and you get it.
No. It isn't. So we should be able to come together, be by the person, encourage the person, and stand by the person through it all so that we can all win together. It's very, very important. Then when these things happen, there's anxiety, there's fear, because people think that because my mother has had it, my daughter can get it, and blah, 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 blah. No, relax. Be fine.
Be fine.
So just need to be around the person, encourage the person. This is the family we are talking about.
Right.
If you don't do, who will do it? Let's not.
We are the ones supposed to be there.
Fear and panic, isolating people, and all that. It's not the best. It kills the people faster
than the disease itself. Wow. Dr. Jean Benson, Thank you so much for making time to be here with us today. And Nurse Louisa Graham, once again, we are very grateful that you made time to be with us once again. I mean, God bless you so much for all that you shared with us. Cervical cancer, indeed, is not talked about enough. And we are grateful that you spent your time helping to educate us and our families. And thank you so much, those of you who are watching from wherever you're watching from, for joining us in this important conversation on cervical cancer. We hope that you're living with practical tips to protect your loved ones and to protect yourselves, whether it's through vaccination, regular screenings, or simply opening up conversations about health. When it comes to cervical cancer, knowledge indeed is power, and prevention is key. By working together, families can create a safe, supportive environment that prioritizes health and well-being. Let's continue to support each other in making health a family priority. Until next time, I want to say a big thank you to my team as well, to my director, producers, camera guys. Thank you guys so much for always holding it down, for spending time and being diligent so that we can bring the show to everybody that is watching. Stay blessed. My name is Mawutor Seade.
A family that sticks together will always be stronger through the stormy weather. I have you and you have me, and that's what makes us family. It's the family life show. It's the family life show. It's the family life show. It's the family life show.